Good afternoon, everyone, and welcome to this afternoon's session, which is a very exciting one. It is talking about transformational and compassionate leadership. I am joined today by Julie, Helen, and Michael, and they will be giving you insights into their world. I'm so used to working with a roaming mic. There will be Q&A at the end, so we'll be running around with microphones, doing a much better job than myself with microphones. So please do sit down, tune in, tweet out, and we look forward to your questions at the end. Thank you.
Thank you very much. Good afternoon, everybody. It's lovely to be here. We left Wales at 5:30 this morning, but we've had loads of sandwiches in the break, lots of coffee, so we're really up for this session. Hopefully you're in the leadership session, you know you are. I know some people were intensively really agile. We can do this very agilely, so if you want to stay anyway, even if you're in the wrong session, you'd be most welcome. So as Hannah said, my name is Julie Rogers, and I work for an organisation called Health, Education and Improvement Wales. And I'm really delighted to be able to share a little bit of our journey with you today, before I hand over to my colleague, Professor Michael West, who will tell you about our leadership methodology and approach, and then Helen will tell you about our wonderful Gwella, which is a Welsh word. It means lift up or to improve, our wonderful Gwella digital portal. So, in terms of our journey, the lady on the left-hand side of the screen is our wonderful Chief Exec, Alex Howells, and she and I were the first employees of the new organisation in October 2018, and we had a set of statutory functions to deliver, one of which was leadership development for leadership at all levels across NHS Wales. And we really didn't have a clue, to be honest, on how to do this. So what we thought we'd do is we would look across the other nations across the UK to see what everyone else was doing. So we reached out to a few friendly faces on Twitter and other social media platforms that are available. And we actually found that there was a community of practice that was happening, which was supported by the wonderful Professor Michael West. And so we reached out to them and we said, can we actually come and join your collaborative? We got on a plane, we went to Dublin. And when we got there, the lady who was organising it said, every nation needs to do a pitch. And in the wonderful way of chief execs, my chief exec looked at me and said, that'll be you then. So I thought, okay, this is absolutely great. So I remember, be like today, some scrappy notes on a bit of paper thinking, what am I going to say? So the phrase we came up with at that point was steer with pride. And for those devolved nations, if there's anybody here from other devolved nations, you will know that actually there is kind of an expectation that you Welshify things or you Dragonize things or you do things with thistle, you know, or that you have, you know, sort of different regions in England. And there's a lot of pressure from politicians in particular to sort of have things that are unique. But I think we're really blessed in Wales, and actually our governments and our system saw there was an opportunity for us to learn from other nations and to work collaboratively, and that's the founding stone really of our approach. So we came back from Dublin, having stolen a lot of really good ideas from other people. We got together a conference. We had about 200-300 people in a room. Michael came and supported us. We had a lady called Fran O'Hara, who's an amazing artist, and she started with a blank piece of paper, and then she drew what people were saying through a day, and we ended up with a vision for our leadership journey, which was incredible, and a set of ideas. These sorts of words down here were the words that the people working in the NHS in Wales said that they wanted us to put into our platform. So that was the start of it. In parallel, we were working on a 10-year workforce strategy for the NHS in Wales. New body, why not give them something really hard to do? We've been up and running 8 weeks, and we were asked to do a 10-year plan. So we designed that in partnership with people, real people, patients, carers, staff who use the services in Wales. And we came up with a workforce programme that had 7 themes in it. And you can see leadership and succession was one of those key themes. And that's our vision that we're working through for the whole of our leadership approach within Wales. In terms of our journey, I'm not going to go through this in too much because this is underpinned by the third box there, or the bubble there in the middle, which is Gwella, our leadership portal. That's where we have been really enabled through digital technologies to really reach lots more people than we would have done otherwise. And we're really proud of that. And without blowing our own trumpet, we have won 2 Learning Technologies Awards for the work that we've done on that portal and for the team that lead that work. So you can see there, that's our workforce strategy. The next thing that we did was a set of principles. So what do we want compassionate leadership to be like in Wales? What do we want it to feel like?
We got the digital portal in place. We then started developing products. And the thing that I really like is Talentbury at the top, which I'm sure Helen will talk about, which was our digital talent festival. And we came up with that name, the chief exec and myself, because I just managed to get tickets for Glastonbury for the first time in my life at the age of 48. First time of trying. All my friends hated me. So we got Glastonbury tickets and I was super excited. And I was saying, we're going to have this big talent event. And she said, why don't you call it Talentbury? Oh my God, that's amazing. So we had tents and not quite circus clowns and things like that, but lots of different music stands and tried to make it feel like it was a proper festival. And that was all digital. So Helen will say more about that. So that's it from me in terms of just the context. Say we're absolutely thrilled to be here. Hopefully you'll find this really useful and we're really up for questions at the end. So thank you. Michael.
Thank you. Hello, good afternoon. My name is Michael West. I'm Senior Visiting Fellow at the King's Fund in London and Professor of Organisational Psychology at Lancaster University. And I've had the privilege over the last 2 years of working with the amazing people in Health Education Improvement Wales on what is an enormously important strategy that's been translated into digital technologies and that's making a real difference to the lives of the people of Wales. It's a huge privilege and pleasure for me. Something about the context of this work. The last 26 months have been really difficult for all of us. You know, if you think back 2 years ago, virtually all of us were feeling afraid for our lives and the lives of our loved ones and the state of our world. And what's been extraordinary during that period is how people have reacted. And the overwhelming response has been one of compassion, and particularly in health services, where people early on risked their lives to care for patient service users in Wales, in the whole of the UK, in countries around the world, but also the compassion that the population has shown. Millions of people have volunteered formally and informally to help health services, to help their neighbours, to hold us all safe during this really difficult time. Health services are now under huge pressure around the world. And the biggest pressure is the workforce crisis that we face around the world, with huge numbers of vacancies. In the United Kingdom, there's probably around 120,000 staff vacancies, representing around 1 in 18 of the workforce, high levels of absenteeism. Staff are exhausted, and they're tired of being exhausted. And so many of them are quitting, or they're on the verge of quitting. And this is a huge crisis for health services around the world, plus the additional pressures of increasingly complex healthcare demands, aging population, health inequalities, and so on. And that's going to require a dramatic, radical change in how we think about how we care for the health and well-being and the flourishing and the happiness of the people in our communities and our populations. We have to transform our health and care services for the future, and that requires real vision. So I feel really proud to be working with Health Education and Improvement Wales, feeling that I can make a contribution to that vision, and the vision is about how we learn from compassion to change the way that we do things. What do I mean by this word compassion? Well, if Jess here, if you're in pain or distress, or you feel afraid, Jess, then to be compassionate, I have to do 4 things. I have to attend, understand, empathize, and help. And attending means being present with you, giving my attention. Nancy Klein talks about listening with fascination. And second, I have to seek to understand the causes of your distress. And I do that not by just imposing my understanding from some, elevated hierarchical position, but through us having a dialogue. And third, I have to have an empathic feeling response. I have to feel your pain or fear or distress at some level without being overwhelmed by it, without making it my drama, because that gives me the motivation for the 4th element of compassion, which is helping or serving you. And we know that there's a real difference between empathy alone and compassion with that additional helping component. So neuroscience studies show us that when we ask people to be empathic to another in pain or distress, that's associated with the activation of various pain centers in the brain. Of course, because we're mirroring the other person, we're feeling the other person's pain. But when we ask people to be compassionate with that additional helping component, intention to help, that's associated with the activation of reward centers in the brain. Why? Well, because evolution has shaped us over hundreds of thousands of years to respond compassionately with these 4 behaviors to others in pain or distress, because that's what enables us to form kinship groups, social groups, tribes, communities, where we protect collectively against threat, where we share resources, where we care for one another. And we also know a lot more now about the role of compassion in the context of healthcare, particularly. Many hundreds of studies over recent years have given us a real insight and shown us that actually compassion is the most important intervention there is in health and social care. And I'll just show you a few illustrative examples. And all of these studies are based on randomized controlled trials, or what are called meta-analysis, where all of the data from all of the published studies on a particular topic are combined to give us an overall picture. The first is randomized controlled trials of anaesthetists visiting patients prior to surgery. And they either do a normal visit where they provide sedatives, or they do a visit where they don't provide sedatives, but instead are extra compassionate in their interactions, attending, understanding, empathizing, helping. And what we see is that the compassion intervention is associated with patients having a much lower requirement for painkillers post-surgically, and they end up having a much shorter length of hospital stay. It's a really important finding in the context of the pressure on hospital beds. The second example is randomized controlled trials conducted in the United States and in Italy of patients with an early diagnosis of lung cancer, likely to be terminal in the short to medium term. It was a study of the quality of life of patients who were randomly assigned either to normal early palliative care or to early palliative care plus early palliative care, if you like, extra compassionate care. So you're comparing patients assigned to normal early cancer care or normal early cancer care plus early palliative care. And it indeed showed much better quality of life for those patients in the early palliative care condition. But what was complete surprise to the researchers was the finding that those patients lived significantly longer. And we see similar large effects of clinician, nurse, doctor, allied health professionals, their compassion in the treatment of long-term disorders like HIV and diabetes, and of therapist compassion in the treatment of mental health problems. Now, what many people, particularly clinicians, think is, oh, this is going to take, compassion's great, but hey, I haven't got time for compassion. But actually the research evidence suggests that compassion doesn't take any more time. But even more significantly, what it shows is randomized controlled trials of general practitioners and nurses asked to be extra compassionate in their interactions with patients over a 2-week period, that has a significant impact on their own well-being, with lower levels of anxiety, stress, and depression. It's consistent with what I was saying about the neuroscience studies earlier. So suffice to say, the evidence tells us compassion is the most important intervention in healthcare, and the effect sizes are really, really large, extraordinarily large. So then the question is, for my colleagues in Health Education and Improvement Wales, with responsibility for a whole healthcare and social care system ultimately, how do we create the conditions in our organizations where staff will treat patients and service users with compassion, and where they'll treat each other with compassion, because those things are linked, and where they'll be self-compassionate? And of course the answer to that question is, well, it's about the culture of our organizations. How do we shape culture? Well, every interaction by every one of us every day in our teams, in our organizations, in our communities shapes the culture through how warm we are, how kind we are, how irritable we are, how cynical we are, how compassionate we are. The ripples spread out and influence other people's behavior. But the role of leaders, we know, is particularly powerful. From the last 100 years of research on organizational culture, we know that the most significant lever that you can use to influence culture is the behavior of leaders, because what leaders pay attention to, what they talk about, what they monitor, what they focus on, and particularly what they portray in their own behavior, tells us what's important to them. It tells us what's important to them, tells us what they value. Whatever the words are on the website about our organizational values, the behavior of leaders powerfully communicates the values of the organization. So if we're to create compassionate cultures across health and social care in Wales and in communities, then our leaders must model compassion in their leadership. And in practice, what that means is what Helen dubbed the compassion compass: leaders attending to those they lead, listening, being present with them, listening with fascination, leaders seeking to understand the challenges that those they lead face. Do you remember what I said at the beginning about the levels of stress amongst health service staff? What we see across the United Kingdom is nearly 1 in 2 healthcare staff report being unwell as a result of stress at work during the previous year. That's unsustainable. So leaders, through a dialogue, seeking to understand the challenges that those they lead face, leaders then having the emotional intelligence and the courage to empathize with those they lead, to feel that pain of a nurse who's on her 3rd 12-hour night shift in a row, not having had time to take a break, feeling too tired to drive safely home in the car. What's that like, to feel that as a leader? And then leaders who help those they lead. And in the context of leadership, helping means helping those we lead to do their jobs more effectively by helping to remove the obstacles that get in the way of them doing their work effectively, and by helping to ensure they've got the resources they need, the right numbers of staff, the right equipment, the right training. And this is not some new fancy model of leadership. We've known for 60 or 70 years from leadership research around the world that probably the most important skill of a leader is listening to those they lead, listening deeply. And the most important task of a leader is helping those they lead to do their jobs more effectively. And we also know from private sector organizations and many other organizations that where staff in organizations generally report that their leaders attend, understand, empathize, and help, that organizational performance is significantly better. In the context of healthcare organizations, what we see is that across the UK, where staff in hospitals, in mental health and learning disability organizations, in ambulance organizations, report that their leaders behave in these 4 ways, subsequently what we see is higher levels of staff engagement in those organizations. This is based on 18 years of data from over 600,000 people a year in our staff surveys. Staff engagement proves to be the most significant predictor of organizational performance, not just in healthcare, but in every sector around the world. And we see subsequently higher levels of patient satisfaction in those organizations, significantly better care quality, fewer errors, fewer avoidable patient deaths, higher levels of staff retention, and better financial performance. Where staff in healthcare organizations generally report their leaders don't behave in these 4 ways, subsequently what we see in those organizations is staff reporting higher levels of chronic work overload, higher levels of stress. Patients report that they're not treated with compassion and dignity and respect. There's significantly worse care quality, more mistakes, worse financial performance, and higher levels of avoidable patient mortality. So for all of these reasons, it's essential that we develop compassionate leadership in our healthcare system in order that we can deliver for the communities that we serve. And this is absolutely not some soft cushion scented candles approach to leadership. On the contrary, it requires much more courage and authenticity to lead compassionately. It requires real courage and authenticity to listen with fascination, to be present with those we lead, to seek to understand their challenges, to empathize, and to commit to help. So compassionate leadership is about being effective as a leader, And effective leadership is leadership that ensures clear direction, an inspiring vision of the work that we do, that's not, again, just a bunch of words on the website, but it's a beacon that guides our decision making day by day and hour by hour. We're here to promote, to create the conditions where the people of Wales, the children growing up, adolescents, adults, elderly people, can lead the fullest, healthiest, happiest, safest, most love-filled lives that they can. That's what we're here for. And it's translating that into 3 or 4 strategic objectives at every level, from the executive team of Health Education Improvement Wales down to the portering team in Cwm Taf. It's making sure that there are clear goals and that then people's work is aligned around those goals, not being dissipated on unnecessary bureaucracy or target chasing or toxic politics or chronic interpersonal relationships, poor interpersonal relationships between people. And compassionate leadership is inclusive leadership. If it's not inclusive, it's not compassionate. Compassion is about belonging. Compassion is a way of, when we show compassion to another, it's a way of blurring the boundaries between self and other. It's a way of establishing a feeling of connection, of belonging, of trust. And belonging is profoundly important in human behavior. We're more likely to die from social isolation or loneliness than we are from the effects of smoking or the effects of excessive alcohol use or obesity. And inclusion, we know, is a key issue in society. It's a health issue. People who are subjected to discrimination over the lifespan, people with disabilities, people from minority ethnic groups, experience a kind of biological weathering effect, which damages health outcomes and affects early mortality, early mortality. So inclusion is a health issue. It's also a performance issue. We know that more diverse teams, when they have direction, alignment, and commitment, are much more productive and innovative. So compassionate leadership is about being inclusive as a leader, everybody feeling equally attended to, understood, empathized with, and helped through our leadership. And it's about collective leadership. One of the paradoxes of our healthcare system here, in our healthcare systems here in the United Kingdom, is we have probably the largest, most skilled, and most motivated workforce in industry. Yet we continue to manage them largely through command and control and extended hierarchies. In the best functioning organizations in the world, regardless of size or sector, they usually have no more than 3 or 4 reporting levels. In the typical NHS organization, the reporting levels are in double figures. And for every reporting level you add, it's estimated 10% to bureaucracy. So the challenge for the future is how we create more collective leadership, how we move away from extended hierarchies towards more team-based organizations where the team is the unit of analysis rather than the individual. And it's how constellations of teams work together to deliver for the people of Wales. That means working across boundaries with social care, with the voluntary sector, with local government, with education, with the judiciary, with community groups, with families themselves, so that we transform the conditions for the people of Wales. And that means that compassionate leadership must be also about how we work across boundaries with other teams, other departments, other organizations, working compassionately across boundaries, always asking the question, how can we help you so that collectively we can deliver for the people of Wales a future that is brighter and better? Wales, by the way, is a great context for all of this. It has a real commitment to all its legislation being designed to care for future generations as much as meeting the needs of current generations. And so together we've been working on this agenda in Health Education and Improvement Wales over these last really difficult 2 years. And together we've identified some key principles for the kind of leadership that we want in our health and social care systems in Wales. Leaders that improve equality, inclusion, and diversity, strengthen respect and voice and influence, enable safe, trusting, engaging cultures. And so The challenge for us now is how we translate that into practical tools and resources to enable people all across the system, actually everybody who works in health and social care in Wales, to develop these skills as leaders, creating environments where collective leadership thrives, establishing the conditions for the workforce to reflect, to learn, to continually improve. And over the last 2 years, we've been focusing on the link between these principles and the kind of cultures we want to create in our health and care organisations. And I should say the other UK nations are following Wales in the example that they've set. How we create cultures characterised by presence, attention, listening, care, because that's critical for us to create the conditions where we can provide the care and support for the people who use health and social care services. And during this last 2 years, certainly for me, being combined into my little study in my house, the support of Health Education Improvement Wales and our working together has been brilliant, because we've been able to work together to produce a book, Compassionate Leadership, Sustaining Wisdom, Humanity and Presence in Health and Social Care, bringing together all of the research evidence, all of the great case examples from around the 4 UK countries, as well as countries around the world, and practical tools and resources which have provided a basis for the development of materials that could be used to develop the supports that we're talking about to help develop leaders across our health and social care system. So Helen's going to talk a little bit about how we've gone on that journey and converted this into learning technologies available to thousands and thousands and thousands of people across the country.
Thank you very much, Michael. You mentioned we've been working together for approximately 2 years, and it's been an absolute pleasure working with you and having you direct our strategy. Maybe not such much a pleasure for you, working with us all the time, but an absolute delight for us, so thank you so much. I'd just like to take a bit of a technical look, or take you through with the technical lens of how we created this strategy into action using some of the technology that was available. So for the last 10 minutes, if I may, I'll just put some of this into context and how digital has helped us move forward so fast and so quickly over the last few years. Julie mentioned this slide earlier on, and this vision for leadership and our workforce strategy was launched in 2020 in the middle of the pandemic. You saw a slide previous to this where we had a conference where we brought people into the room and we listened and engaged and helped create that strategy together. However, our vision there, that by 2030, leaders across health and care will be collective and compassionate leaders, is a very strong ambition. And we needed to achieve that by 2030. However, we were in the middle of a pandemic and there were no in-person events. So we had to accelerate and change and think differently about how we were going to deliver this strategy, where the evidence that you've just heard has has directed where we go. So we had 3 strategic actions in order to deliver this workforce strategy. Action 25, which was delivering a consistent approach to leadership across health and care. And Michael and Julie have talked about that strategy and the evidence behind that strategy. But I'd like to focus just for the next few minutes on Action 26 and Action 27. So Action 26 was about establishing an accessible range of leadership development resources and programmes for individuals in NHS Wales as well as organisations across NHS Wales. As I said, there was no in-person events. Somebody had said recently that in the last 2 years, we've accelerated 50 years. And I think from a digital perspective, you as well as I know that the last 2 years has helped us really accelerate and move forward to deliver services different. And that was no different to what we did to ensure that we met Action 26, to establish that accessible range of leadership development opportunities. We also needed to think about Action 27. So how do we develop talent management pipelines for the most senior leadership roles in NHS Wales? And how do we do that without any software? So I'm just going to take us through the journey of what we did. So we looked across the system. We stole with pride where we could. Where there was nothing to steal with pride, we looked at how we could work together in a co-productive relationship to create a one-stop shop for leadership and talent for NHS Wales. Our demands was quite significant because the system needed to be bilingual. No system existed that was bilingual from the research that we undertook. We needed our portal, our leadership portal called Gwella, to be accessible to everyone. So wherever you were, across the UK and wider, you could access the resources that we were going to develop and share through Gwella. And we needed to be open access. So those were the three key things that we started with. And with nothing in place, we worked together with Thinky to discover what was available and how we could create this journey together. We've had so far, since this was launched, which is about 18 months ago, nearly 500,000 hits on our pages, which we have created using not just the resources that we've developed, but resources from across credible organisations such as the King's Fund and colleagues across the UK. We've got approximately 3,000 account holders, and our ambition was that this would supplement the organisations in NHS Wales. So we weren't going to replace anything, but we were going to create an environment where anyone could just stop on this page and look at the resources that were available to help create compassionate leaders, to help create compassionate cultures using the principles that Michael was just talking about. We've currently got 3,000 account holders. There's just about to go up to 5,000 account holders. So we are starting to create a critical mass of usage for Gwella across NHS Wales. I'll pop the live version on towards the end of the session, but just having a look very quickly, as you can see, we've got bilingual, we've got about Gwella, we've got a talent area, which was Action 27, and we've got our orange box there, which is all our resources. Clicking on that orange box gives you access to hundreds of toolkits and resources and webinars and podcasts. So everything that we've developed is now available to anyone using Gwella. So where we stole with pride, we're now happy to give with pride. So please help yourself. We also wanted to create vibrant networks of leaders across NHS Wales that could help embed the culture of compassion. We started off with several networks, and as you can see, we now have 180 networks and communities of practice from individuals across NHS Wales in different organisations, in different professions, and university students also participating in these communities. We've also got a huge amount of programmes, leadership programmes that are available to anyone, but also there's a private area that you can access as well. And these are asynchronous programmes as well as synchronous programmes, and enable us to create vibrant learning pathways for individuals. And I'll show you a little bit about that in a moment. The other thing we've managed to do over 18 months is host 220 conferences, masterclasses, programs, and virtual events. And I think that's just been the beauty of having a solution that is user-driven, and it has become a very usable portal for the people of Wales. And as you can see there, there's some famous faces across the bottom. And we've created webinars that are available on demand. And Christmas time, we offered a box set of the most elite leadership speakers that we'd had over the year that our leaders could just access and play on demand. And again, they're widely available. Julie mentioned that we've had some success with the portal, and that's thanks to Emily, who is the system architect. So if you want to give us a wave, Emily, I'm going to embarrass you in compassionate leadership style. And our colleagues from Thinky. And after just having the portal available for a number of months, we won with Thinky the 2020 Gold Award for the best UK digital transformation of a training programme in response to COVID. So I think that was really significant because the portal had only been live for probably about 4 months. We went forward in 2021 also to win the Gold Award for the Learning Technologies Team of the Year. So we're really, really proud of what we've achieved to date.
So we're in early days for 2022, so no pressure. But hopefully we'll be back here towards the end of 2022 with maybe another award, and who knows, Wales in the World Cup. So that would be a celebration. A good celebration. So moving on to the programs, because that action that required us to give free access to resources, but also programs for organisation. And these are just some of the programs that we've made available nationally from Health Education and Improvement Wales over the last 12 to 18 months. So we've got, for any learner at any level in any profession, a range that individuals could just commence their learner journey or their leadership journey and enter in at the appropriate part. So we've got Introduction to Clinical Leadership. We've got Discovering, Developing and Delivering, or the 3D program as we've dubbed it. And that's more about quality improvement and the leadership and the cultures required to sustain that. We've got Compassionate Leadership in Practice, which we co-designed recently with Glyndŵr University. That was endorsed by Professor Michael West and supported by Professor Michael West. And also it runs for 7 weeks, but also attracts 15 or 20 credits at master's level. I'm not going to go through them all, but you can see there's a range of programs for your profession or your level of leadership, moving right up to our most recent program, which is Leading with Compassion. And that's for our aspiring executive directors, because we have that responsibility also for talent management for the more senior of roles. Supplementing those programs, we've got the masterclass series that we provide, evidence-based resource bundles, networks, conferences. And more recently, HEIW has become the Welsh hub for the Institution of Health and Social Care Management. And this gives our leaders and managers across NHS Wales access to even more leadership and management resources, power hours, special interest groups, and additional conferences. So the range of resource we have is really now significant. Julie mentioned Talentbury, cracking name, it was absolutely brilliant. And the 4-day festival of leadership, learning and collaboration commenced in October 2020. So we were in the middle of the pandemic. We'd only just really gone live with some of the functionality. 3 days before this 4-day massive conference, Thinky decided to upgrade their system. So put more pressure on everything, which absolutely ran perfectly. And what we had was a main stage event with keynote speakers, credible experts. We had a workshop village because we wanted to co-design the leadership interventions that we needed to move people from perhaps manager roles into more executive or senior leadership roles. We had a collaboration dome and we had testing of what was going to be developed and open spaces and various things. So over those 4 days, we had 300 aspiring executive leaders from NHS Wales attend Talentbury to improve their own skills, but also help support what we were going to develop, because we were in a virtual world. And they helped us develop 3 phases of our talent management strategy, which was around identifying talent, developing talent, and then deploying talent. So in the identifying talent, we've now got a really good understanding of some of the leadership, supply and demand across NHS Wales. So where are our aspiring executive directors and which roles are they aspiring to? Where are our pipelines and where are we lacking in some of the pipelines? So we now have some good intelligence on that. We've developed talent through many of the opportunities I've just shown, but we also had masterclass, executive coaching, leadership diagnostics, all added in to develop our talent. And deploying talent is now looking at where we can actually look at the jobs as they're moving or coming up for vacancy and moving people into those positions after supporting them effectively. We've reviewed our data in our talent pools, and as you can see, there's just a glimpse there of where the perceived readiness was for a board position. The data here shows that approximately out of about 130 in the talent pool, a third were ready now, a third were ready in 1 to 2 years, and a third were ready in 3 to 5 years. But this was perceived readiness. It wasn't tested against a competence framework. And you can see on the other side the types of roles that we had pipelines for and some of the roles that were really lacking. So we had some really good intelligence, but we needed to do some more work on that. So what we developed was an executive success profile, And that provided the competency framework for what we were going to measure our aspiring executive directors against now and going into the future. So this success profile is made up of the components of competencies, personality, values and behaviours, and the transition requirements required. And that enables us now to have a really robust means of assessing the requirements of the individual against the post. We've put some governance in place to help us expedite this journey, and we're focusing on some key areas that refer about, which include inclusion and access to our talent pool. Are we being equitable? And then where are our priorities? So significant work going on there. But I'd like to just finish on where we are going, if I may. So our talent management software, that again has been supported and developed in partnership with Thinky, has enabled us to get more mature about our talent and identifying our talent. So we've enhanced the registration to Gwella and to our talent pools, so we have our diversity and our demographics clearly mapped out. We have our executive success profile, and that enables us to look at the competences and look at the gaps, look at our ready now, and then proactively provide development opportunities that meet those gaps. And we have 360 degrees and self-assessment, so we can do some check-in against where our gaps are and where our peers see that to be. So all of this is coming online in the next month or so. I'd just like to show you, before we finish, if I may, the live version of Gwella. Hopefully that'll kick in. Maybe not. There you go. And that's what Gwella looks like in real life. So thank you so much. And I'll hand over to the team for any questions.
Thank you. That was very inspiring, actually. And I know where the Welsh team need to come to if they need some transformational leadership to win. So we're now open for questions. We've got runners in the room. Are there any? Straight at it. Look at that. The hand goes straight up, straight into the questions. You can have a quick sip of water because he's clearly keen.
Thank you, Hannah. I mean, to what Hannah said, really, just impressive. The accolades, the achievements, the data that you've got, the data that you've now gathered around things like your talent pipeline, career progression, those things. So what did you get wrong? Because like what I've heard is the amazing things that you've done. And I mean, I'd be impressed if you didn't get anything wrong on the way. But one of the things I guess about stuff like this is we often hear about the amazing stuff. We don't hear about the stuff you got wrong along the way. So my question is, what did you get wrong along the way?
I think that's a really good question, actually. I would say that we were talking about colour insights, the psychometric model that actually allocates you to colours. And Helen and I are bright yellow, which means we're really up for it, really excited by change and love innovation, and we go at it. And coupled with a chief exec who's probably also very, very sunshine yellow, that does sometimes make us a bit of a dangerous trio because we do kind of think that's a great idea, let's go for it. So I think with our talent pool, when we first created it, what we underestimated was the immaturity of the NHS organisations that we'd be pulling from, because our role is the top tiers, although increasingly we're involved in the other tiers. And so we just said, give us your most talented people aspiring to be directors or chief execs, and we'll work with them. And what we got was 130 amazing people, but when we started to work with them, a lot of them weren't ready or anywhere near ready. And in fact, we started to unravel some, I've put my hand up, so my organisation's going to nominate me. I always ask for development, so my face fits, so I'll get it. So we created a talent pool that we've worked with now for 2.5 years that is not particularly inclusive or equitable. And because of that, I think there's a little bit of cynicism, because some of the people in that pool feel as though they've not got promoted, they've not had opportunities, they're in a pool but nothing's happening. So that's why we put a lot of energy and effort into coming up with assessment centres, exec success profiles, so we know that when we bring people into the national programme, that they are actually people we can work with to get them to be the next cohort of senior leaders. So that was a big thing for us, and I think we were, you know, we were under quite a bit of pressure to create the talent pool and get it off the ground, and we kind of leapt into it. I probably would do a bit more groundwork with local organisations next time.
Wonderful, thank you.
Oh, another hand's coming straight up. I will run round. Do not worry, I'm closer.
Thank you. Thanks. Great presentation. Very inspiring. And yeah, I can see there's a huge amount of work that's gone into that. So thank you for sharing with us. I have a question in terms of, you mentioned this is a supplementary platform to the NHS in general and whatever, I suppose, staff can access already. How did you align your content and particularly in terms of competencies and behaviors to what's already there in the open source forum? NHS have a huge amount of open source resources, particularly around well-being conversations for leaders, resilience, etc. I know because I've read it all, it's really good. And we needed it in the last, over the last 2 years. So how did you align or make sure that it was consistent? I suppose you wouldn't want to have a platform that promotes some behaviors and values, etc., that's contrary or you know, in contradiction to what the NHS promotes.
Yeah. Oh, okay. Yeah.
No, you do it.
Yeah, great question. And we've been quite consciously curating the materials that we put on Gwella. So we signpost to credible materials, but we also have a quality assurance group. And we make sure that all of the content that we put on there is quality assured by NHS Wales to make sure everything is aligned. So we try to be as inclusive as possible, but ensure that that is aligned to all the strategies for NHS Wales before it's live on Gwella.
Yeah, I think just to add to that, if I can. So when we were setting up, 6 months prior to setting up the organisation going live, we went to meet with NHS Scotland, or NHS Education in Scotland, which is a sister body to us. One of the things they said to us was they'd been going for 18 years, and when they'd first started out, they made the mistake of developing a load of national stuff and just said to the NHS, have this, and there was a lot of resistance. So what they'd learned over time was actually building their products alongside the local ones so they were complementary. So that's the approach. We learned from them significant learning. So for us, we actually sort of build our stuff so that it's complementary and supportive. And as Helen says, we try wherever possible to curate rather than to reinvent. And so one of the things we're working on at the moment is to put the access to the Gwella portal as a tab on local intranet sites, so they don't have to come to our national site in order to access it. They can access it off their own home pages, and then that means it gives staff in those organisations the best of both worlds.
So I can just like to add a brief comment, say that I think one of the things that happens in these large systems is that the ideas keep changing. So some national policy gets developed, and then you have a new cohort of leaders, and then it gets changed, and it gets changed again. What's, I think, unusual, and remembering we've got 4 separate healthcare systems across the 4 UK countries, separate but interlinked in some ways, is that for the first time, all 4 of them are focused on developing compassionate, inclusive, and collective leadership. And there are huge programs going on across all 4 countries now, a bit behind Wales, the other 3, but there are huge programs going on across all 4 with these same coherent, integrated messages about the kind of leadership and the values that are needed.
Fantastic, thank you. One of the joys of being chair is that I also get to squeak in a question if I want to. Michael, you were saying how the NHS are understandably exhausted, but they're also tired of being exhausted. How did you engage with stakeholders that are clearly at the brink of exhaustion and beyond to take on something new that's going to require energy?
In one sense, I think in one sense it's a burning platform. I described at the beginning the workforce crisis that many countries around the world face now because of shortages of staff, very high levels of stress, and increasingly high levels of stress. So in one sense, there's a thirst for how can we go forward? And I think the response that we have is an evidence-based response. Look, this is what the research evidence tells us about the kind of leadership and the kinds of culture but deliver the outcomes we seek: high quality care, patient satisfaction, good financial performance, staff retention. That's very persuasive. But you don't achieve that in one presentation. It takes hundreds and hundreds and hundreds, drip, drip, dripping out the message. And particularly at the moment, it's desperately needed.
Thank you. Any more questions in the room? Because I could talk to Michael and Julie and
Helen.
your good self all day. Helen, I had a moment then. I had a moment that was scary. Hold on, here we are.
Loads of great resources there, loads of hits, which is amazing. So clearly a lot of leaders and managers are accessing that programme. But I wondered if it's too early to know from maybe staff surveys about if there's been any improvements in practice, about what people are feeling and doing and seeing, on the front line, but with managers being more developed with the resources that you're providing, or is it too early to tell yet?
Yeah, I think that's a really good comment, actually. So we're not in the business of taking on lots of new functions, but there was an opportunity last year to take responsibility for the National Staff Survey for Wales. So we persuaded government to let us have that. So we've now got responsibility for that. So we've been working with Michael and others to actually embed in the next staff survey, which is due in the autumn, compassionate leadership. So we'll be able to measure some of the impact. Obviously, there's a lot of learning from what's happened in England and the survey there. So, and our survey in Wales is sort of, it's done this really in terms of this number of questions, that number of questions. So we're looking to get some really firm evidence base to support it. But Michael and I were having a conversation earlier on, and I think for us now we've got enough of a story and a product, enough kind of testing of this and co-producing it, that really for us this year it's about getting out and finding people in the service who want to actually not just support this, but want to be activists with us, because we've got to socialise it. So we've got a session coming up with our trade union partners across NHS Wales to really get them. They're on board, but they're not promoting it. So how do we get them into local organisations to kind of really be the advocates for this for us? So long way to go, and this is culture change, and it takes years. But I think the survey will give us a snapshot in time, and then we can build on that going forward.
And so, there are good examples. Berkshire Health, which is a learning disability mental health NHS trust and organisation, they've been retraining all their staff in compassionate leadership over the course of the last 4 years. So they've now retrained more than half of all of their staff in compassionate leadership, with a strong focus on self-compassion as well. And in the recent staff survey results in England, which came out about 3.5-4 weeks ago, it's perhaps no coincidence that Berkshire Health is the best learning disability mental health trust in terms of staff morale, staff engagement, lowest levels of stress. Northumbria Healthcare Trust, a large acute trust in the north east of England, has for some years been developing a strategy for its organisation focused around patient experience and staff experience. That informs the boards and the executives' decisions, and they adopt a very much compassionate approach to leadership, supporting their staff in order for them to deliver for patients. And again, in the staff survey results, amongst the acute trusts, they came out best in terms of staff engagement, lowest levels of staff stress, actually half the levels of staff stress for the country as a whole. So, there are lots of examples like this, but together they accumulate to provide really compelling evidence about the importance of what the work in Wales is seeking to achieve.
Oh, I spotted one question behind, and then one question here as well.
I've already had one, so do you want to go someone else?
True. That is true. Hold on, she's just coming to you. Okay. Perfect.
Hi, I'm interested in the compassionate leadership model and whether or not it's just healthcare or whether you can take that elsewhere. We work at NHS Blood and Transplant, and we believe you've just been doing some work, Michael, with our organ donation teams. I've now got the responsibility of leadership and management to think about how we support the rest of the organisation, and I'm wondering, am I going to have multiple models, or can I have something that works across the board?
Yeah. Well, the People Promise in NHS England has as its first principle compassionate and inclusive leadership. So that's the current direction of travel at national level. I think this time it'll be sustained, I hope. it'll be sustained. But I think compassionate leadership is important in any sector, in any organization, in any community. Compassion is, it's not a kind of, oh, here's another skill we're going to add on. It's one of our core emotional regulation systems. We've got three, if you like, you can think of it as having three core emotional regulation systems. One focused on dealing with threat, one focused on meeting our goals, achieving our goals, and one focused on nurturing, compassion. And it's a natural response, it's a natural capability, therefore, but it's one that we have to nurture, like any capability. And I think to some extent, there's a sense in which in some of our modern organizations and some of our modern communities, there's an imbalance between our emotional regulation systems. We've become more focused on maybe achieving our goals, acquiring resources, and a lot of focus around threat. And that, the rising levels of mental health difficulties across our country and the sense of alienation of many young people is perhaps testament to that. So I think there's something important about us making a collective commitment to creating more compassionate cultures in all of our organizations, in all of our communities. I mean, we spend a huge amount of our lives in our work organizations, yet when you look at the data across Europe, something like only about 20% of people report feeling engaged at work all of the time or most of the time. I mean, it's tragic. It's so sad. Life should be beautiful for people, it should be wonderful. And work organizations should be places where people thrive, not where they wither on the vine, as it were. So I think there's a huge need for us to develop compassionate cultures and via compassionate leadership. And especially given that the data indicate to us this is how we also achieve the organizational outcomes we seek.
We'll be heading to the website instead.
Oh, I've got a question coming out at the back here. But absolutely, steal away. Well, when I did my MBA, they called it creative swiping. And I've been using that term ever since.
Hi, thank you for the presentation. Coming from a military background, I can absolutely see where compassionate leadership could be useful, but it's more of an exception than a rule, I think, in my background. From an NHS point of view, from an outsider looking in, forgive me, but I see it almost like preaching to the choir, because I would expect health professionals to want to be compassionate and be compassionate individuals anyway. I'm just wondering, out of curiosity, what leadership traits were you seeing before you did this initiative? And what are you said it's a culture change. What are you transitioning from?
Yeah, so I think yes. I think people enter, health and care. Most people are motivated to care for other people, and so they have got intrinsically that desire to nurture. I think there is a huge wealth of evidence about people being broken, burnt out, and overwhelmed. And I think despite that, that the desire to go into those sort of professions, actually, we find that people are leaving and they are struggling. And as Michael said, people are becoming ill and burnt out. So, and I think it's something about, the system, the layers of bureaucracy that we've got in the NHS. Michael talked about the collective aspect of compassionate leadership as well, where you've got, you're basing it around teams and teams working together and supporting each other, as opposed to lots of hierarchies, which we've got in the NHS. So I think the system is doing things to people. I think the last 2 years have been incredibly difficult. We definitely need to put some compassion back in to remind people for why they do the jobs that they do, but also to enable them and to stop the system from doing things to people because of targets and waiting list initiatives and ministerial and politics and all of that stuff. So I think that would be the diagnostic for us. We wanted to find a leadership model. We connected with this because it is so strongly evidence-based. And I do think it taps into something, as Michael says, that is there intrinsically in the people in our service. But I also feel passionately that we need to help people. And I think this is a great way to do it, to create the right culture and conditions that they can thrive in.
And so I think, some of the factors that are problematic are a multiplicity of targets and goals. So we see, what we call in the health service, priority thickets. There are so many priorities that no one can see what's important anymore. And as Julie says, there's this kind of, in many parts of the NHS, a top-down bureaucracy which is demanding productivity and in information and numbers and so on. And it becomes a pressure that is transmitted through to leaders who then start managing the people that they lead in that way as well. I've been really, your military background, I've been really impressed by what's happened in the military over recent years with the move to mission command, I think it is, where strategic direction is set at the top, but the people at local level are trusted with the how of delivery. They're expected to ask if they don't know, but they're trusted with the how of delivery. And that's something about collective leadership, that kind of collective leadership that we need to develop in our healthcare system as well.
Oh, I've got extra questions popping up. Here we go. I'm going to go for a little run.
Hi, I'm more familiar with the American system and children's hospitals specifically. But what I've found in organizations is good ideas, good values, they kind of stay within one level, and they require that the leadership do the right thing and that it goes through. And I guess I'm wondering how compassionate leadership impacts or is shared with people who are at the very lower levels of an organization, the cleaners, the people answering the phones, the people making the food. So I guess I'm wondering, do you have a solution for that? Do you have a strategy for it? And do you assess the impact that you have within the entire organization?
Yes, I think, as I said earlier on, this year for us is the year about getting out actually and reaching deeper into some of those organisations. What was really important for us was to get the politicians on board and the senior managers, and we got that mandate 2 years ago. We've now been working with a lot of the leaders in the system, a lot of the OD teams and the workforce teams, and some of our clinical areas. We're going to be targeting our trade union leaders and our social partners soon and actually getting out into organisations. But we do, we can't, as our team in HEIW, be getting this embedded into every organisation. So what we've got to do is create that energy within organisations in partnership so that they take it on. We're starting to see some examples in Wales, but it's quite early days for us around this. So it's a bit of a nucleus. But as Michael has said, we have actually got quite a few examples across the UK of organisations where this is working. But very, for us, we're just at the start really in terms of getting this embedded at all levels in organisations.
And I think ultimately, Emily, the idea is that everybody will be developed, that everybody's leadership capabilities will be developed, because it's essential in health services, because quality and safety is everybody's responsibility. It's the responsibility of the domestic staff, of the portering staff, of the estate staff. So the vision is to really see this as a leadership development program for everybody in the organisation, so that everybody learns to take responsibility when they see something unsafe happening, or inappropriate behaviour happening, or discriminatory behaviour, or poor performance, that people feel safe to speak up and deal with it. And that has to be the vision of where we're headed.
Can I just add, actually I wasn't going to come in, but just to add to that, Michael, there are light spots across many organisations in NHS Wales, and one of our organisations, it's the Facilities and Estates Department actually, that has started to embed compassionate leadership, and the changes coming from, I think every contact count has been the mantra, with all staff at all levels in estates and facilities trained in compassionate leadership. And that webinar or podcast is available on Gwella, so I shall send you the link so you can listen to how they did that and the results that they started to see.
Nice plug, Hal.
I was actually just going to end with the plug as we're running out of time. So when people want to come and creatively swipe your fantastic library of content, what do they need to Google to find your portal?
Yeah, Jen?
Gwella Wales, yeah.
Go for it, Em.
NHS Wales leadership portal.heiw.wales, something like that.
Okay,
I'll just Google Gwella, that'll come up as well.
I like how they say just Google that, like I know how to spell that word, never mind pronounce it. Well, thank you very, very much, Helen, Michael, and Julie, for coming such a long way. I can tell from the depth of questions everyone was listening, and that's really important. So big round of applause, and have a fantastic journey home.